So I have drawn up my medication and I have labeled them. Before I give the meds again, I will do my third check. I would check again my meds, and I would check my 5 rights for the third time. So now I've checked whether it's compatible, incompatible, how fast I have to push it, whether it's 1 minute or 5 minutes. In this case, it was going to be a 1 minute push, and whether it's going to be diluted or not diluted. Okay. Alright, so now I am going to flush, do my before flush, and then I will put my medication. So I go and I just okay, I'll just pull back on the plunger a little bit and let the air out. Let the air out a little bit. Pushing up, good. Okay. Alright. I don't need any gloves or anything like that, so because there's not going to be any blood. So I just do this and just rest this down for a bit. Scrub my side. Scrub my port really nicely. I have to do it in the one closest to the patient. Alright, so now I'm done. I'm going to insert my flush. I put my flush in, okay. And I'm going to pinch off here, clamp it here, and I'm going to push my 2 mils of saline, checking for patency. I'll check for infiltration, resistance, you know, any of these things, and it's flushed well. So all done. Okay. Alright, so now I'm going to put my medication. This one is the one that's the incompatible one, so I'm going to now I take my needle off and I hold it without contaminating. Put it in, make sure I clamp off the line here so that my medication don't end up going back this way, and then I have to put it in 1 minute. So I would clamp off and push in some meds, then I would release, clamp off, push, release. I'll do that until the 1 minute is up, and then I would remove. Okay, so I put in my meds and that's done. Okay. Alright, now I'm now going to flush again for I would okay, so I would do the same thing, pull back on my plunger and then push out the air a little bit. Okay, and then I'm going to put it in here, screw it in, clamp it off, and flush with my 2 mil saline after. So this is my after flush. It's went all through, it's good. Done now, and that's it. So the important thing that I have to remember with this scale is to check my medication, flush with saline, give the meds, then flush with saline, and that's exactly what I did. Now I'm going to do the compatible one. This one is my compatible medication. So I don't need any flush, and I don't need any gloves. There's no blood contact. So I'm just going to scrub it out and put the meds in there. Scrub it out. Okay. Alright. And get my medication. Take off the blunt needle. Hold it. Sterile to sterile. Screw it in and clamp off. and then I push my medication through again. This is also a 1-minute med. I pinch, release, pinch, push the medication, release, pinch again, push the medication, release. Do that 4 times in 15 minutes intervals, and then it's 1 minute, so it's all given. Take it off, and my medication is given. So at this point I would just clean up, wash my hands, and then I would go out to document. What would I document? I would, before I do that, I would make sure that my IV is stable, though. I would, you know, just maybe after I'm done, just, yeah, okay. I would document. What I would document, I would document the meds that was given, the time, it was 1 minute, the dose, what I observed, if there was any kind of redness, any problem with the site, how the patient tolerated the medication being given, any complications, and then that would complete my skill. Thank you.